Hi, everybody. I think we're going to get started on our next session. If you would like to continue to grab any of the snacks, feel free to do so. But just in the interest of time, we want to make sure that we can get all the information to you that we can today. So this next session is our Mental Health and Me, and we are going to be joined by Dr. Helen Sue. So today's session will be focusing on mental health, liver disease, coping strategies, addressing emotional challenges, lifestyle changes, and navigating some of that healthcare system stress. So I'll give a brief introduction of Dr. Sue. We'll have a live discussion, and then there'll be a short Q&A at the end. So Dr. Helen Sue is an addiction and mental health physician in Ottawa. She works on the inpatient addiction medicine consultation service at the Ottawa Hospital and supports patients with substance abuse and mental health issues in the community with both medication and psychotherapy. She works with the hepatologist at the Ottawa Hospital to provide comprehensive liver and mental health care for patients. Dr. Sue, welcome.
So, hi everybody. So thank you for the introduction, Anisha. And I just have a few slides. They're quite general, just sort of the principles of mental health, how we think about it conceptually. And I'll go over it with you, but I hope really to have questions and a more interactive conversation, especially since we are a smaller group, so it's perfect for that. So I hope you have questions that you would bring forward. And so this is a way that we talk about mental health and how everything is connected. And I just wanted to introduce you to this slide. It's from cognitive behavioral therapy. If you've been in contact with the healthcare system, you might have heard this. It's also known as CBT. Your doctors may have told you, like, you should get some CBT, as if it's something you can just go to the store and buy. Not so simple, but this is the diagram that lies behind the theoretical framework for CBT, and it's basically, what goes on in ourselves, and maybe this will resonate with you, right? So basically it's our thoughts, our emotions, and bodily sensations, right? So particularly somebody living with chronic disease, there'll be changes in your body that you have perhaps noticed, and they can all influence each other, and it can then lead to a different behavior. Right, and the situation will also, of course, impact everything that's going on. So I can give you an example of how this can play out. So I have a really lovely patient in my practice, and she had a dental procedure, and it was one where she needed to be sedated. And that evening she was home, and everything had gone well, and she thought it was okay, and she was actually quite proud of herself that she didn't have a panic attack at the dentist. But then that evening, she felt like her throat was closing up. She had this foreign sensation in the back of her throat. And then she started to have these thoughts from this sensation that she noticed that, oh, I am having an allergic reaction to something they gave me at the dental procedure. My throat is closing up. And as she had these thoughts of my throat is closing up, she started to feel, as you can imagine, quite fearful and very panicked. And as she felt more panicked, her heart was beating faster, right? She felt the sensation even more. And so, being a very reasonable person, she went to the emergency room, right, to have it checked out. And she said, oh, I'm having a terrible allergic reaction. And when she got there, they had a look, and they said, oh, actually, no, it's not an allergic reaction. You have the development of like a bruise in the back of your throat where they just hit something when they were doing the dental procedure. And so the swelling that you notice, it's very real. It was there, but it's from the formation of a bruise in the back of your throat. And so you can see, though, how that sensation and not being able to explain what is going on led her to have all this spiraling panic. And this is something that happens to us a lot, that we do to ourselves. And so it's really useful to notice, okay, what is happening in my body? What is the story I'm telling myself about what's happening in my body? And how does that change my experience of it? So that's something I kind of want you to keep in the back of your mind, right? Because this will come up in your lives all the time. Yeah? And so how do we engage this thinking part, right? And how do we stay, keep our faculties about us and not enter this stage of panic? This is the worst possible thing is happening, right? So I like to say, this another psychological first aid skill I offer to my patients is the imagery of you're dropping an anchor if you are nautically inclined, or you like, going to the river. Some people hate the water, in which case I say, okay, think of this as your tree growing roots, finding solid ground, whichever imagery you like. All right, and so it's the ABC psychological first aid. And so the A is to acknowledge the difficult feeling, the difficult sensation, right? Don't run away from it. Don't be afraid of it, right? Say like, oh, I'm having this discomfort, right? And I notice it. I notice this discomfort in my abdomen, right? This is a liver disease conversation we're having. But you come back to the rest of your body. Right, so, or like, oh, I'm feeling a lot of sadness about all the things I used to be able to do and I can't do anymore. All the things I used to be able to eat and now my doctor says I can't eat them. Right, and I'm feeling a lot of sadness, a lot of grief, frustration. And come back to your whole body, not just the part that perhaps is, causing a difficult experience, but come back to your body, come back to your breath. Right, notice where your feet are in space perhaps, move your shoulders around. Right, come back into your body, generate some different sensations in your body, right? Because we were talking about how all these things are connected. So change the sensation in your body, or maybe you try to notice what is the textile fabric texture of what I'm wearing, right? Can I come back into this present moment? And the C is to count what's around you, so engage with the environment. So I say, count 5 things that you can see in the room. Right, so now I see a lot of people in this room. I see the gentleman in front of me has a white cap. I see some snacks over there. I see carpet, and I see lights. Okay, so now I'm back in this room. Right, you can also count. Okay, are there sounds that I'm hearing? Or maybe I count 3 things that I hear in this room with me. And the point of doing this counting, when you go through your senses, is to come back to this present moment and to remind yourself, like, actually, I'm still here. Right? I'm still breathing. Even if you're in the hospital, and sometimes I do this with patients I'm meeting in the hospital, and I say, come back to this place, even though this place is maybe a little bit scary, you're still safe here, right? You're okay, you're safe here, and when you do go through the ABCs a few times, right? So you keep acknowledging that difficult emotion, keep coming back to your body, and you keep coming back to your body in this place, you will get to a place where you can think about, okay, what's next for me? What do I want for myself, right? And so for mental health, the foundations of mental health, right, the basics are always the same. You will hear this from everybody, right? You need to optimize your sleep, make sure you're sleeping regularly, sleeping enough, exercising, moving your body in a way that's accessible to you, right? And that's not going to the gym and running on the treadmill. Like, that's not accessible or even necessary for most people, right? But moving your body in some way, right, in a cardiovascularly beneficial way, right? Your diet, people with liver disease, there's so many dietary restrictions, and depending on the disease, it's all different, right? And your doctors will tell you what those restrictions are, but to really try to follow those dietary recommendations. Alcohol, my specialization is substance use disorders. Alcohol is not compatible with liver disease, it just isn't. Other substances, probably not compatible either, but even medications, right? Those of you living with liver disease will know that your doctors will tell you there's a limit to some medications that's different for you, like even the most common medication, Tylenol, right? The limit is different for somebody with liver disease and somebody who doesn't have it. And so to incorporate all of that, and then to keep working on how to reduce the stresses on your body and also on your mind. And perhaps easier said than done, but it's important to acknowledge that these are the important building blocks. And with these building blocks, you can flourish more as a human. And so, how do we do this, right? And how do we flourish as a human? And so these are, they did a lot of psychology studies, and they found that when they ask people what are things that make you feel well as a person, that make you feel like your life is fulfilling for you, people are doing a variation of these things, and that's consistently human. And so engage with the living world, right? Being out in nature with the trees and the birds, right? And the sunshine, right? If you put yourself back in a time when you were engaging and fully present with the living world out there, I think you probably do remember that that was a pretty good feeling. Right? When we interact with other humans in a healthy way, right? We're social beings, we need other people. Giving back to the community, right? This is something that actually comes up a lot when people feel better when they are engaging with other people and they're giving back. And that really helps promote well-being. And then also, yeah, being active in your own body in whatever way that's accessible to you, and that looks different for everyone, and that's okay, right? But usually people will say, I was active in my body in some way, and afterwards, even if during it was hard and I didn't like it, afterwards I felt better, right? And also learning a new skill, right? When was the last time you learned something that you didn't know how to do before and you noticed yourself getting better at it, right? That really promotes people's sense of well-being, to gain mastery in something new. And so these are some ideas for you, right, on things that you can do when you're kind of feeling like I need to engage with a different behavior to change those other internal states, right? And then a little thing about hepatic encephalopathy, just a small medical education point. So this is like a very rare but can happen medical complication. So if you're living with somebody with chronic liver disease, or if you have it, just tell those around you that sometimes people can have too much ammonia build up in your blood, and that can cause encephalopathy, which is just to say your brain is almost a little bit poisoned, is a fancy way of saying that. And it can be grade 0, so really small, subtle changes that really only the person or those closest to them would notice that there's been a change, right? And then there's grade 1, which is like they're confused, more forgetful than normal, more mood swings than normal, right? And they have some difficulty with really simple math that maybe they didn't have before. Maybe they are writing a little bit, having difficulty, right? And there's a disruption in the sleep-wake cycle. So these are just things to look for, because hepatic encephalopathy is a medical emergency that you would want to get assessed for or talk to your doctor about. And then grade 2, right, it's a totally different person. They're acting differently. They're tired. They don't want to do anything. They're very confused. They don't even talk normal anymore, right? And then grade 3 is even beyond that. So they don't know where they are, really, really sleepy, very, very confused. And maybe you'll notice some shakes. And then grade 4, you're calling an ambulance before grade 4, but just to kind of put this out there as something to be, just again, plant this seed to the back of your mind. If ever you live with somebody with liver disease and you start to notice these things, just kind of ask yourself like, oh, did they have a bad night's sleep, or could it be this hepatic encephalopathy thing? Maybe we should call the doctor. Let's see, right? Do you want me to do the next?
Thank you. Yeah, I'll just take that from you. That was fantastic. If you want to come take a seat, we can go through. Yes. So thank you so much, Dr. Sue, for that. That was excellent. We have a few questions here for you that are common questions that we've received. So our first one is practical coping strategies. So can you share some practical coping strategies for managing mental health challenges that come with liver disease that you've mentioned before? And how can patients and caregivers implement those strategies into their daily lives?
Yeah, and so I think the ABCs of psychological first aid, right, always come back to yourself first, right, and acknowledge the difficulty of what's going on, right? In my practice, I really talk to people about not running away, not avoiding, right? So it's about acknowledging that, okay, I have a chronic disease, right? And so knowing that I have a chronic disease, what do I want my life to look like? right? And so how can I envision a life that is healthy and interesting and fulfilling to me while having a liver disease, right? And that's a question to ask, I think, in terms of mental health, and is to really allow yourself to have hope, right? That this is, of course, possible for you, right? That you can still have a very wonderful life while living with a chronic liver disease. And so to come back to this vision for yourself and your life, and then the path on how to get there will become clearer, right? Once you have this idea.
Absolutely, absolutely. I think that's very, very important. Now, in terms of, navigating some of those emotional challenges that might come with it, dealing with a liver disease can be quite emotionally challenging. So what advice do you have for patients and caregivers, navigating overwhelm especially, and maintaining a positive outlook for the more, long term?
Yeah, I think it is hard, right? It is hard, and it can be at times overwhelming. And I would say remember that you are not an island, right? Nobody is an island. And so the longer this journey is, the more to lean on your resources, right? And your resources can be internal to you, right? So you are a person who is still breathing, and I assume you have gone through hard things already in your life. How did you navigate those challenges before? Right? What are your strengths that you're bringing into navigating this challenge? And your resources can also be the people around you, right? So that's your healthcare system, right? The people that are there to support you from the healthcare system, and all the people in your life, right? Your family, your friends, maybe other support networks that you could find. And so to survive, right, this long road is to kind of really find your resources and to use them, right? Use them for your benefit, just like how you giving back to the community. I'm sure if others leaned on you, you would reciprocate the same.
Absolutely, absolutely. Finding community is incredibly important. So how can patients and caregivers recognize signs of mental health strain, and what are some of the first steps to seeking help for that?
Yeah, seeking help. Help is always, important to look for, but it's quite fragmented in the delivery in our province. But I would say the first signs would be notice in yourself. And so another kind of theoretical thing that we use a lot to illustrate is we have this idea called the window of tolerance. So literally picture like a window, right? And so when you're inside your window of tolerance, you're able to be uncomfortable, but you still feel in control of your emotions. You can still talk about things even if they're a little bit hard, right? And most of us know what we're like. Hopefully you're in your window of tolerance now sitting here. And then when we're out of the window of tolerance, we can either go up or we could go down. So when we go up, that looks like, agitation, frustration. People are talking faster, right? And that's kind of what you'll notice is that they're talking faster, they're snappy or impatient, or, and the person, what they'll notice in themselves is, they're speaking louder, they're speaking quickly, and their heart is going faster, right? So they're just entering a more agitated state. And that's a sign like you're outside your window of tolerance and maybe you're getting overwhelmed, right? So come back, right? Psychological first aid, ABCs, come back to your window of tolerance. You can also go below, and that's the people who freeze, right? And they get overwhelmed and then they just stay and they stop talking and they stop engaging and they just shut down. And maybe the person interacting with them is working even harder to try to prod them into a response, and the person is just shutting down even more, right? And that's a hypoactive way of being overwhelmed, which is also very common. And it's okay, but it's okay to notice in yourself that, oh, even though I'm frozen, it's actually a sign I'm being overwhelmed. So the agitated way of being overwhelmed is very easy to notice, but also, right, to notice the hypoactive way of being overwhelmed, because it's just as important. And it's just as important for those folks to also come back to a window of tolerance when they feel comfortable and safe to talk again, right? To engage with their thinking brain, their own problem-solving brain.
Absolutely, absolutely. That's so important.
Oh, sorry. Oh, you asked me also how to find help. Yeah, so in Ontario, healthcare, mental health, unfortunately, is mostly privatized. So if you are in a position where you have access to private benefits through your employer or your spouse's employer, then that puts you in a position where you could access some kind of a mental health support. Of course, asterisk, I would say mental health support is mixed quality, so make sure you find a practitioner that actually seems knowledgeable and is a good fit for you, because different people work different ways. There's different styles of giving therapy. So if you meet the first one and it doesn't work out, don't write off everybody. Try somebody new, right? Try somebody else, and maybe it'll be different, right? So please don't generalize. And so that's the private sector, and that's the most accessible way to get mental health support. In the public sector, it's hard to get something in the public sector, but perhaps your physician would be aware of some resources, and it's also very regional specific. So I would say, talk to your healthcare providers and say, hey, I'm struggling. Can you think of some mental health resources that might be available that's publicly funded in our area? And please refer me or tell me about them, and I can look for them.
Yeah, absolutely. Finding those resources can often be such a huge barrier for people. So whether it's private or public, it's important to have them. So understanding disease impact on mental health is huge. So how can liver disease specifically impact mental health, and which aspects should prompt someone to seek mental health help with liver disease?
So the hepatic encephalopathy, right?
Right.
That slide was there because of that question. And the other thing is I think with any chronic disease, what I see a lot is a sense of loss. And there's grief there. And I don't know if it's acknowledged or talked about enough, right? Because there's always your life how you imagine it to be, and most people don't imagine their life, when you're 20 years old and you're imagining your future. You don't think, oh yes, and then I'm going to be living with a chronic liver disease. That's not really the vision that somebody has for themselves. And then it happens, and you need to accept it, right? And we always say, like, acceptance is not approval. Just because you accept something doesn't mean you like it, and you don't need to like it to accept that, okay, this is a part of my life now, though, and I have to figure out how to move forward with it, right? You could be like, I hate this, and it's okay. It's okay to acknowledge that part of yourself that's like, I wish it were not so, right? And to sit with that sense of, I wish it were not so, and because what's underneath that is that grief and that loss, right? Loss of that vision of how you thought your life would be, what the things you can do that you cannot do now. Like, that's very real, right? And we don't want to push that away or pretend it doesn't exist, because then you're like denying yourself, right? But to also say, along with this, right, to go back to the hope part, is like, I'm still a human being who's going to live my life. And I want my life to still be interesting and fulfilling and healthy. And so don't spend all your time living with that grief and the loss, right? So say, this is there, and the other part is still there, and so let me also put some of that energy in envisioning this life, right? What that can look like, right? Like dietary changes. All right, let's roll with it, right? You said you guys just had a little diet muffin demonstration, right? And I tried it. It was very tasty. Right, so it's still possible, right? So it's to look at the possibilities of what is still there for you as well.
Yeah, and that rolls right into our next question about lifestyle changes or activities that can improve mental health with liver disease. And I think you mentioned some of that earlier, but is there anything else that you'd like to add to that?
The 5 things, right?
Yeah.
Those 5 things are universal to help live, in a more fulfilled way, right? And we always say the goal is not to be happy all the time. That's not possible, right? And if you're peace all the time, you're content all the time, you're dead. Right? And there's no one more at peace than those who are deceased. This is not possible. Not possible for those of us who are living. And so 100% calmness, like, I'm sorry, that's not the goal, right? But the goal is something that is interesting, right? And that gives you a little bit of that sense of like, you know what I'm talking about, that positive affect inside. And those 5 activities is some idea of that pathway, how to get there.
Awesome, thank you. And what advice do you have for dealing with stress and frustration that can come with navigating the healthcare system, whether it's mental health or liver disease or both?
So hard. It is so hard.
Uncertainty is really hard, or waiting.
Uncertainty and waiting, yeah, absolutely, right? Like we don't sit well with uncertainty, humans. We want a plan and we want it now, right? And we want our results right now. We want to know, right? And you know, when you have a chronic disease and you're in the system, you're always like waiting for the appointment, and then you're waiting for your results, and then you're waiting for the follow-up, and then you're waiting for the next thing, or you're waiting to see, oh, what's happening with my score, my number, and all the numbers and all the acronyms, and they're always changing, right? And so I think it's to let yourself sit with it, right? And acknowledge that this is hard, right? So I think like my message to everyone is really to just say like, you're going through something hard, and you will do it nevertheless, right? Because you know how to do hard things. You've all done hard things, right? And I know sitting with that uncertainty is hard, but is to feel it. You let yourself feel it, and then you say, is there anything I could do right now? Right? I often talk about feelings as, they're cues to ask us to act, maybe, right? And so, if your feelings are appropriate for this context, just you act, right? If there's a car barreling down Bronson at you, you will feel afraid and you will get out of the way. This is appropriate fear. I want you to feel afraid. I want you to feel stressed in that moment. I want you to behave, to adapt to that situation, right? But there are times where our feelings are really, really big, and there's nothing we can do with it. So how do we sit with those feelings? And it's to come back to your present moment, come back to the here and now. Right? I'm waiting for the doctor to call me. Do I trust this doctor? Well, they haven't not called me before, so I guess I need to trust them. And they're my doctor. Doctors are really hard to find, so I guess I'm going to trust that they will call me. Okay, so I know the doctor's going to call me. And now I'm just waiting. So what do I do? Well, what can I do today? Right, what other things can I do with my body and my being today that I think will help me? Because sitting here ruminating about whether is the doctor going to call me, when is the doctor going to call me? Okay, is there anything I could do to make sure I don't miss the call of the doctor, maybe? Okay, well, I can make sure my phone is on ring and I don't block private numbers. Please don't block private numbers. My patients miss my phone calls when they block private numbers. Please don't block private numbers. Okay, so I'm not going to block private numbers. I'm going to put my phone on ring. Is there anything else I can do? Okay, probably not. So what else can I do instead of sitting here and letting that cycle, right, of the thought of I'm so worried about the result, and now I feel worried in my body, right? And we all feel worry in our body in a different place. Like sometimes some of us feel in our stomach, some of us feel in our chest. We all feel it somewhere. And now I feel it, but because I feel it, I feel dread. And because I feel dread, I'm going to tell myself, oh, when the doctor calls, they're going to give me the worst possible news, and it's going to be this, and then I feel more dread. And you enter this cycle. And in the end, this cycle is not actually what's happening right now. What's happening right now is you're waiting. And it sucks. I'm not saying it doesn't suck, it sucks. But if you've optimized everything you can do right now, then ask yourself, okay, what else can I do to cope today? Yeah.
Absolutely. And having those coping strategies is so key, whether it's distraction or something else. I can imagine that those can be really key for people.
One of the 5 things, go out for a walk in nature.
Yeah, absolutely.
Go learn a new skill. People, a lot of my patients, they take up like little skills, knitting, crocheting, pottery is another popular one.
Oh yeah.
Yeah.
I can see that as being very therapeutic for a lot of people. So my last question today is, how can mental health care be effectively integrated into an overall treatment plan, especially for liver disease? And what role do healthcare providers that people are seeing, how do they facilitate that?
Yeah, that's a good question. I think it depends on the needs of the individual, right? Because different people will have different needs and different things that they need to process. It would be helpful for the care team if the patients, and I know you guys have to do so much already, makes me feel awful to ask you to do even more. But to say I give consent for all the people involved in my care to communicate with each other. That's actually really, really helpful. And so if you can say that to your mental health provider and say that to your liver specialist, right? And then they all kind of do this thing where we do the equivalent of CCing each other, but on charts. And, you know, or just to say once that consent is provided, you know, your mental health specialist can write to your liver specialist and say, hey, they're really struggling with this. Like, what is going on there? Just because a lot of them don't have medical training and they don't know exactly what is going on a physiological level to be able to offer the right type of support. And so if the liver specialist or family doctor fill them in, that can help them, right? And so to allow your providers to all get on the same page, that would be actually quite helpful for everybody involved and would in turn, of course, help you, right? Or then your physician can reach out to your mental health specialist and say, hey, I think they're actually, you know, struggling a lot with this particular aspect of living with their disease, and if you can help them with that. And then that way your mental health specialist can guide the therapy in that direction, right? Or at least get your permission to talk about it. And they can say, oh, your doctor is worried about this. Are you worried about it? Because maybe you'll say, no, actually I'm fine. I just wanted to vent to my doctor. That's not what I'm worried about. I'm worried about this other thing, right? But it'll cue them to check in with you.
Is that something that patients should be proactively providing their doctor with that consent, or are doctors usually going to ask patients for that? Doctors won't ask?
Doctors won't ask, no.
Okay. So having a proactive approach to letting them know that is usually the best way to go.
And yes, absolutely, and you'll probably get a surprised look from your doctor because that's not a conversation they're even used to having, but they'll be like, oh yeah, that's cool. Right, because I work with a lot of psychologists, and that's what they actually often say is they try to, like, first of all, they need to get consent from their client to reach out to their physician, and then when they do, the physician is always so appreciative.
Right.
Right, but they're the ones initiating that.
So usually it's if you have a mental health professional that you're working with, they would often, if you don't ask for it, they would be the ones to ask?
They could.
Okay.
Depends on the person.
Right, of course.
they work with me, so they're like more comfortable with the
Right.
medical side of things as well, right?
Well, that's very good to know. That was incredibly helpful information. Thank you so much. I am going to transition to our Q&A. So if anyone has any questions here for Dr. Sue that you would like to ask, and if there are any questions that you think of later on, you are more than welcome to email us and we can pass them along as well.
This liver thing is just another one on top of other chronic issues. And I was 15 when I first got sick. So this one, I'm feeling numb. I don't know if it's like, oh, well, whatever. I just do my day. So I do what I can. And I just can't get my mind into dealing with this one. So what do you do?
Let me ask, can I ask you a few more follow-up questions?
Absolutely.
You say you're feeling numb and you can't get your mind to dealing with this one. And so when you say that, I'm wondering, what are you thinking of? Like when you say, I can't deal with this one, what would dealing with this one look like for you?
If it was the only one, I'd probably submerge my mind into it and know everything and just go with it.
Okay.
As I already have like 4 or 5 chronic diseases on top of that, and then get told that, you have to start dealing with this and having these tests, and I'm like, okay, just call me, let me know what date, and I'll be there.
Yeah.
Like, it's like I'm not stressed about it, I'm just like, okay, well, just let me know. I was dealing with Dr. Onofrio. Well, she moved.
She did, unfortunately.
I wished her best in finding a place in Toronto.
Yes.
It's tough.
So now I'm with Dr. Tan, and she did a test. It'll be 2 weeks on Monday. And I have another one at the end of May. And then somewhere in June or July, I go see her. So I'm just kind of like flowing with it. So I don't know if that's right or wrong, or
I mean, it sounds like you're doing the best that you can, right? And you're showing up.
yeah,
You know when your appointments are, you're going to them. You're not avoiding it, you're not pretending none of this is happening and saying, no, I'm gonna stay home and ghost the doctors,
no,
right? So you're showing up, and showing up is the biggest thing, right? You're showing up, and you'll find out more information as the tests go on, right? And so right now it sounds like, from what you said, finding out, right? If you had nothing else going on, you would be reading everything about this thing, right? And so maybe a suggestion I can make for you is, it sounds like you're doing everything you can right now, and that's great. And if you're finding that there's just a little gap, is maybe a little bit of information to make sure that you're not doing anything else that's going to hurt your body, then just ask that for Dr. Tan when you see her, right? And
Yeah.
say, hey, is there, I don't want to read more about this, that's not on
Yeah.
the table right now. And she'll say, that's okay, right? And you give me the Coles notes, right? And maybe bring somebody with you who can write things down for you. Perfect, right? And
Awesome.
quickly just give me the summary of what I need to know.
Yeah.
And then just leave that there, and then keep going through your day, do your life, right? And I think you're already doing well.
just maybe just giving permission.
Yeah. And sometimes the practical tips are the most impactful anyway. So learning those from Dr. Tan can be
Yeah.
a great way to go.
You know, like I feel kind of, I don't want to say stupid, but it is kind of stupid that I've just like put my head in the ground and said, okay, we're going to go really learn how to go with the flow these days.
Yeah, yeah.
You know.
And now that you're learning to go with the flow, how do you feel about having another diagnosis?
The going with the flow is kind of nice because I was their typical type A personality. Everything had to be perfect, and I was high stressed, and now I'm just like,
Yeah.
you know, if I'm tired, I go to bed, I have a nap.
You're like surfing the waves.
Yeah.
You're doing great.
You know, so I'm like going, okay, this is so weird.
Acceptance, not approval, right?
Yeah,
Yeah, and you're going along with it. Yeah, it sounds
Okay.
like you're managing quite well.
okay. It's just, it feels weird.
It's a different way of being. You're trying
Yeah.
something different, and you, as you say, actually kind of feels nice.
Yeah, because,
Wonderful.
thank you. And one of the things that you were saying earlier kind of touched a button, and it's basically what you just said, is just, you're not accepting it. It's just, it is what it is. But with me feeling this kind of just this wave thing is unusual. So I give you all permission to go with the wave.
Thank you so much. That was
Thank
wonderful.
you.
I just wanted to add a positive to what she was evoking, you know, feeling so down, but you should give yourself a pat on the back because you showed up here today. You want to learn what you made the choice to do it.
Yeah.
She helped you, but you made the ultimate decision to come here, and that's where you're starting now. So you deserve to have a pat on the back for that.
Absolutely, absolutely.
Oh, that's so lovely. Thank you for saying that.
One of the things I'm curious about is when sort of liver disease progresses enough and you're at that stage where, you can't take that many Tylenol in a day and you're dealing with an acute pain event, maybe it's pre-surgery, maybe it's post-surgery, like right after. So can you touch on some maybe like strategies for coping in those contexts when you need to deal with severe pain? Thanks.
Severe pain. Yeah, so pain is your body telling you something, right? If it's acute pain, chronic pain is a different story that we can talk about. But if you're living your life and you're surfing those waves, going along with the flow, and then suddenly there's acute pain, something is wrong, right? And I want you to get it checked out by a doctor, right? I don't want you to sit at home and suffer with that pain for too long, because there are different medical conditions that can happen as a complication of chronic liver disease. And so when in doubt, right, get to understand your body and the cues that they're sending you. And if it's a new thing, it's safer, always better safe than sorry, right? So have it checked out, get to understand what exactly in your body is causing you this pain. And if the question is pharmacological management of pain that's not damaging for the liver, there's lots of different medications that are helpful that physicians can prescribe that will be helpful in acute pain to help manage the sensation, to make it less intense. But first have it checked out, of course. Yeah. I'm not sure if that answers your question or if you had a follow-up.
I'm more wondering, sort of, in addition to medical pain management, what sort of from a mental health perspective could be ways that could combine with the, let's say, analgesics or whatever to, I don't know, mindfulness,
Yeah, is it a living with pain situation?
I'd say more acute pain,
Okay.
if you're having trouble managing it yet.
Okay. So like in this hypothetical situation, like are you thinking about a specific?
Post-surgery.
Post-surgery.
Yeah.
Okay. All right. So post-surgical pain, if you're in the hospital, they should have a team that can help you with that. And there's a limit on Tylenol, but there's other medications. And if you want to speak to non-medical medication type of management, that's your question, is definitely to imagine your body right after the surgery. It's going through a lot, right? Your body is, someone just cut it open. Your body's not going to be happy, nor should it be happy. It should be pretty angry, right? We would want it to be angry. It's normal to feel pain in that situation, right? And because there's all that inflammation, and inflammation causes pain. And there's inflammation because, the doctor just cut you open. You're supposed to be in pain. I don't want you to not feel pain. That would be a different problem that now then needs to be addressed. Right, so I think that expectation piece is really important, is that to sense pain in a post-surgical context is expected and actually in a way healthy. And so if they're giving you everything that they would give you, that is reasonable, and how to manage that residual sensation, right, is to reassure yourself, right? A, you're in a safe place, you're in a monitored setting, right? There are people there who are there to help you, who can escalate the management if you need them to, and that this is expected and healthy. Right? And sometimes reassuring ourselves goes a really, really long way. Right? And then it's to, if right now, when you have pain, and if you put all your attention to where it's hurting, I promise you, I guarantee you, try this the next time you get a paper cut or you stub your toe. If you put all your attention there, your pain suddenly will amplify 3 times or more, I promise, because you're putting your attention there. Right, and it's to say, again, not about pretending you don't have pain, not about, oh, I don't have abdominal surgery. No, it's to just say, knowing that if I put all my attention there, I'm going to amplify this experience of it. Where else can I put my mind, right? So can I put my mind on a TV show, right? Is that a healthier place for me to go right now? Can I put my mind on, calling somebody I really care about and having a conversation with them about their life, right? Tell them to send me pictures of the dog, the grandkids, right? And to go there. Or maybe I put my mind and my energy into writing, right? Into kind of writing and processing for myself. Like, whoa, I just went through this really, really big thing. What is the difference this is making for me, right? And why is this important to me? And to allow yourself to engage with the experience in a different way than, this is hurting, oh, this hurts so much, Because the more you live there, the more that pain is amplified, right? Like that cycle from the very first diagram I showed you guys.
Absolutely. I think that is probably our limit on our Q&A today. Thank you. Oh, quick question, hopefully.
I'm a huge advocate for mental health support. And one of the things I was thinking of is accessibility, circling back to that, for those who may have mobility issues or live at a certain distance from the greater Ottawa area. Are you aware of any virtual care programs and resources that could be available in this region or in Ontario?
For mental health?
For mental health, yeah, virtual care.
So most private therapists these days will do virtual appointments. I would say video is better than phone because you get more information with the video platform. But of course, I know a stable internet connection is also sometimes a luxury. So phone access is the best that you can get, so be it. Are you asking about private or publicly funded?
If there's any really like programs that even at the healthcare level, hospitals and clinics, do they start to look at offering this so that we have, if any of our liver community may be at a distance and have to travel more often for that mental health support, that it's something that may be a program that's for virtual care to really assist them.
Yeah, that's a really good idea. There's nothing that I'm aware of, and you're from the staff here, so if you did, you probably know about it. I would say that's definitely something that perhaps can be brought up with the Ottawa Hospital, right? To set up some kind of a virtual, even peer support program, perhaps, right? That can be beneficial and helpful, or virtual psychoeducation, right, on dietary changes or healthy living.
Yeah.
What that can look like, and to offer that for people who are just geographically difficult for them to come into one of the hospital sites.
Yeah.
I think that's a good idea.
Perfect. Okay, thank you.
Heather, did you want to add something quickly?
Just to add that it's only been around for a couple of years, but there is free counseling available through a program called Counseling Connect.
Yeah.
Okay, great. Counseling Connect is the program?
Yeah, counselingconnect.org.
.org.
It's available for the greater Ottawa region.
Okay.
As far as like Cornwall, Renfrew, and those are actual counselors. The folks at the district center do a wonderful job, and those are volunteers.
Okay.
And then at Counseling Connect, those are counselors from Somerset West, Centertown Community Health Center, Jewish Family Services,
Great.
et cetera. And in theory, you can only get up to often you can get an appointment like next day
Oh, wow.
on the website, or maybe within a few days.
And it was called, sorry, one more time.
Counseling Connect,
CounselingConnect.org for the greater Ottawa area, that's right?
like Cornwall, Renfrew.
Cornwall to Renfrew area,
They
okay.
come specifically by the community for the community counseling.
Okay.
African Caribbean, Black, Arab, Jewish, LGBTQIA+, etc. So you can see a trans counselor, you can see a non-binary counselor, you can see a Black counselor, so people who understand the world that we live in.
Yeah, by the community for the community counseling system sounds great. Thank you so much for that addition. I just want to make sure that we stay on time because I know that you're having to go, but I wanted to thank you again so much for your contributions. This has been so helpful, I think, today, and hopefully will continue to be for the recording, for people to be able to access this information. I just wanted to thank you again, and we have a small thing for you to take. So thank you so much for coming. We really appreciate it.
Thank you. Take care, guys.
So if anyone has If anyone has any additional questions, you can feel free to email us and we can always pass those along.